Welcome to Netsmart Care Threads, a podcast where human services and post-acute leaders across the healthcare continuum come together to discuss industry trends, challenges, and opportunities. Listen as we uncover real stories about how to innovate and improve the quality of care for the communities we serve. Let's get into the show.
Hello, everyone. My name is Monica Oss, founder and chief executive officer of Open Minds. We're a distinguished national market intelligence and management consulting firm specializing in the health and human service field. In this episode of the Care Threads podcast, I sit down with Dave Strocchia, Senior Vice President and Managing Director of Human Services at Netsmart, to discuss some of the pressing financial sustainability concerns facing behavioral health provider organizations. Dave, I am looking forward to this discussion today. In the past year, we've kind of went from, post-pandemic to this kind of new world of delivering health and human services. And I think our shared customers, the behavioral health organizations, have a lot of financial sustainability issues that they're going to need to look at. From your perspective, what do you see as the strategic issues that are facing the behavioral health field in the months ahead?
Yeah, thanks, Monica. It's great to speak to you again. I love recording these sessions with you and the team from Open Minds. And you're 100% right. It's a challenging time to be a behavioral health human services provider in the United States today. There's a lot of challenges that are hitting providers that are our clients and that are your clients. These are challenges that are hitting all of our clients and all of our providers on a regular basis. And all of those are really translating into what I'll call margin compression, right? So, Netsmart's a business, and in addition to working with our clients, we work with our business, or we work on the business, and we try and manage things from both a top line perspective and a bottom line perspective. And what I mean by that is top line is really our growth, right? It's the revenue that we're producing, it's the business that we're driving, and then our bottom line is what's the profitability we can drive from that, right? How much does it cost us to go deliver that revenue? And there are many challenges that human services providers are facing today that are compressing that margin, right? Things that are preventing the top line growth that they'd really like to provide, and things that at the same time are frankly causing it to be a little bit more expensive to go get to that growth. One of the number one things that we talk to our clients about on a regular basis is workforce, right? You talk to just about anyone, they would say that their number one inhibitor to growth is workforce. And what we like to tell our clients is stop thinking that you're in a workforce crisis or a workforce challenge. You're in a workforce competition, right? You're competing for workforce with all other providers and frankly other organizations that aren't even human services providers. But what that means is that the cost of labor is up, right? And so that's something that, can really hurt your ability on the bottom line to go in terms of the cost that to deliver those services. Now, during the pandemic, really what we found is that there was an influx of funding, right? Grant funding, federal funding, right? Other things that were happening that were helping our clients to sort of combat some of these things. Those are not necessarily continuing in the same way that they had before. And so then that requires a different way of thinking about the problem in order to make sure that you have the same level of funding that you've had in previous years. At the same time, human services providers are being challenged to use technology in new ways, right? So if you think about the problem, if historically we've looked to leverage more staff to try and fill in gaps, if that's not necessarily an option because the cost of labor is higher than before, or because the staffing just isn't available, then part of the solution is how do you turn to technology to make the staff you do have more efficient or to fill in gaps? At the same time, our providers are seeing new and different types of competition. There's studies that you see every day or market journals that you see every day about private equity-backed organizations getting into behavioral health and addiction treatment, about IDNs or hospital systems expanding the types of services that they provide and getting into behavioral health and whole person care. And, really what this does for our clients is it makes it imperative that they focus on value, right? And value as a definition is the value is what you're providing over the cost that it's costing you to provide that value. And, I think that's really, Monica, what we want to get into today is what are some of the things that behavioral health and human services providers can focus on to, number one, focus on top line, right, to grow their business, while also focusing on bottom line to reduce the amount of cost to go deliver that same level of productivity?
Well, you've really done a great summary of kind of, I would say, the big strategic issues, the competition for workforce, the end of the pandemic dollars, the need to focus on value and kind of compete based on value. But I'd like to drill down a little bit more on the last piece, on that top line piece. It has really been critical for behavioral health organizations to kind of compete for revenue, to compete for consumers, compete for health plan contracts. And you would think if you picked up the paper that there would be no problem because demand is at an all-time high. But there seem to be challenges in terms of the demand for integrated care, the kind of backward integration by health plans to deliver some of their own services, the private equity that you mentioned. So what do you see as the opportunities right now in the field, and how should our behavioral health executives be organizing around pursuing some of the new opportunities that are popping up in the field?
Yeah, I think you're 100% right, Monica. The good news here, or the silver lining in this equation, is that there is a lot of opportunity, right? There's opportunities for growth for behavioral health organizations. And like you said, a lot of that is because the demand has never been higher, right? The demand for the types of services that your clients, that our clients provide has never been higher, right? And a lot of that is a testament to the great service that they've been providing for many, many years. And so, there's lots of opportunities. One of the biggest things that we see is the opportunity to diversify. And you're seeing this across the board. You're seeing providers who historically were focused on mental health, providing integrated addiction treatment services. You're seeing organizations that maybe were historically behavioral health and addiction providers get into IDD, start to provide autism and APA services. And then the other thing you're seeing quite a lot of is these providers diversify into primary care. And many, many of our clients, I think you're seeing the same thing. I'd love your thoughts on it. They're starting to think about, well, how can I provide integrated primary care services within my behavioral health environment? Because the individuals that I'm seeing, they sorely need it and are sorely looking for access to primary care services.
Yeah, I think you've hit on I see as the big opportunities. Like you, when I'm working with an executive team, my message is there's lots of opportunity out there. It just looks slightly different than it did 5 years ago. And the big piece is really exactly what you said. How do you serve those really complex consumers that have co-occurring disorders, they have IDD and mental health issues, they have autism overlay, and very importantly, in getting those, very choice health plan contracts, how do you have an integrated care strategy that lets you do primary care?
Yeah, 100% agree. I 100% agree.
The big thing we're seeing now is, I think the pandemic and telehealth did one really important thing, which is it has freed up the behavioral health leadership teams to not think about having to deliver primary care in any one way. That they can be a CCBHC, they can do in-home primary care, they can do virtual, they can become an FQHC or a lookalike, that there are many more options. And I think, and I guess my question for you is, if you look at that expanding market for these very, people with very complex needs, do you see some key technologies that they should be investing in to be able to pursue that top line growth in this new market?
Yeah, absolutely. And Netsmart's a technology company, right? So that's where my mind goes. I'm a technologist by history and by trade, and I would say absolutely. Number one, it's so critical to have an integrated record. And what I mean by that is, as you look at these organizations that are diversifying in terms of the types of services that they provide, that are providing integrated primary care, oftentimes they're doing that either in part or in total as a part of a value-based payment arrangement, right? Where they're taking on some form of risk, whether that's a capitated payment, whether that's an incentive payment, whether there's some kind of financial penalty that's potentially in play. They're taking on risk. And when you're taking on risk, that means that there is some amount of outcomes measurement that you're tied to and that your reimbursement becomes tied to, whether that's to use some of your examples, whether those are CCBHC outcomes, whether in the FQHC space, it's things like UDS measures, right? There are outcomes measures that can impact your reimbursement. And in order to truly manage that, you need to know more about your client, right? You can't have your behavioral health data in one area and your social determinants of health in another area, and then your primary care information in another area, because all of those things form the picture of the total healthcare outcomes for that individual. And you truly need a data strategy to pull all of that information together, either into a single record or at a minimum into a single business intelligence or data platform in order to understand the total healthcare outcomes of every single individual that you're working with, and then with your population as a whole.
Well, you brought up one point I left off that I would like a comment about. You're talking about integrating the physical, behavioral, the social determinant assessments, that entire consumer record. I think that one of the big challenges facing specialty providers, whether they started on the mental health side, addictions, IDD, is solving the interoperability puzzle. That they need to be part of the whole in order to do population health management and get those analytics. What do you see as kind of the best practice around interoperability?
Yeah, get as much data as you can, right? If you have access to data, go get it, right? And bring it into your environment, right? So that would be my recommendation, right? So if there's a local hospital system in your area, go integrate with them, right? Go get ED alerts from them, right? Go create a referral partnership with them. If there's a local HIE, sign up. Get involved in the Care Equality Network, right? Do those things. The great news is that from a technology perspective, there's more standards and more widely adopted standards today than there ever have been before. And one of the great outcomes of the ONC regulations, right, that organizations like Netsmart have to abide by to be a certified EHR is that you have to adopt standards. You have to be able to create and consume CCDs. You have to support FHIR APIs, right? You have to do these things. And that's not just true of companies of Netsmart. That's true of any technology provider that has an ONC certified electronic health record. And that creates great opportunities for interoperability and frankly makes it a lot easier. And one of the things that I wanted to touch on while we're talking about interoperability and we're talking about payers is, if we're looking at some of the ways that Netsmart clients, that Open Minds clients can grow, right? Look for growth areas. I think another big way to do that is improving the relationship that you have with payers and health plans. And this is something that we recommend to all of our clients is, go create those relationships. If we're talking about diversifying, it's not just in the services that you provide. It's in your reimbursement sources, right? And if you're locked in and tied to a single state's Medicaid, then you're kind of at their mercy. And I'd like to ask, I don't know if I'm turning the tables on you, but Monica, I'd like to ask you a question. What recommendations do you make for your clients as they look to create a stronger relationship and negotiate better rates or create better relationships with their payer sources?
Well, I'm glad you mentioned that because that is a key to taking advantage of any of these new top-line opportunities. Most of them come from health plans. I mean, even for the provider organization that is Medicaid-centric, it's 80% of the Medicaid population is now managed by some kind of health plan, and that just keeps ticking up every year. We're recommending a couple things, and it starts with you have to be able to do managed care flawlessly and in a cost-effective manner. It can't be by hand. You need technology to do revenue cycle management and take care of, I would call it the administrative piece of managed care. The second piece is to get the better contracts, to go beyond being a commodity referral for a health plan and get those value-based contracts that have returns. You have to be able to demonstrate the value you mentioned in the opening. You have to come with the performance analytics and the ability to do that. And then the last piece, and this is reiterating the interoperability piece, if you're going to have that value-based contract, it's not enough just to have your own data. most of the value, our annual survey, we saw the top reimbursement bonus factors were readmission rates, diversion from emergency rooms, and follow-up after hospitalization. None of those are really possible to manage without some kind of interoperability link with the rest of the system. So I would think of it, Dave, in that way. Those three things are really critical to being a success, having a successful and profitable relationship with the health plan.
I couldn't agree more. And I think it all boils down to playing offense, right? I think the number one recommendation that I would make is play offense, find a way to play offense, right? If that is diversifying your service line by getting into new types of service delivery, if it's creating better relationships and negotiating with health plans, if it's diversifying geographically, right? So you are not so dependent on any one state, right? If it's providing the best possible experience for the consumers that you're serving so that they choose to receive services from your organization. Find a way to play offense to increase your top line.
Well, I'd like to pivot a bit with that because while, the growth strategies sound good, the opportunities are many. I think you've talked about the technological underpinnings for growth. We've talked a little bit about health plans and optimizing health plan relationships. It still is challenging to manage all of this to a positive bottom line. And as we think about, in the opening, financial sustainability is top line, bottom line. I do think that the entire field needs to be thinking about better management practices in order to, be net positive with all of these new programs that they're offering and continuing to offer traditional services. What do you see as kind of the key management practices for getting that positive bottom line?
Yeah, I think some of the good news here is that it's not new. It's not a new ask for behavioral health providers to do more with less, right? Our clients have been asked to do more with less for probably as long as they've been in business. But there are a number of things that we recommend to our clients or that we think providers can look at, and I'll talk about a number of them. I think the first one I would touch on is find ways to reduce your administrative cost, right? There are parts of every single organization where there's spend that you have that is non-productive, right? When it's not directly tied to service delivery, right? Or it's not directly tied to what actually drives your top line, and find ways to go reduce those administrative thoughts. One of the big things because again, Netsmart's a technology company, right? One of the big things that we look at is how can you leverage emerging technology in the area of automation to remove those administrative burdens and to reduce your administrative costs. There are more automation tools that exist today in the technology landscape than there ever have been before. And it's one of the areas where, frankly, technology is moving even faster than the rest of the landscape, right? So if we were to go back in time 5 to 10 years ago, there's no such thing as robotic process automation. There's no such thing, or at least not in our space. Nobody's talking about artificial intelligence. No one's talking about machine learning. No one's talking about natural language processing, right? And these are all things that exist today. And I truly think automation is the key, right? We have to find ways to automate repetitive tasks within the space. Or I'll give you a great example, right? We talked about CCBHC. For every single CCBHC client needs to collect NOMS data and they have to report it to SAMHSA. And up until very recently, SAMHSA did not allow for the electronic submission of that data to their portal. And so a lot of CCBHCs hired human beings to type it in, right? Type it into the SPARS portal. And there are so many things that exist like that today because across all of the different states have state reporting requirements. Our clients need to find ways to automate that. And at Netsmart, we offer the ability to do many of these via upload, right? And everyone that we can find. But tools exist today like robotic process automation, which is a really fancy way to say that we're going to train a computer to do the same repetitive task as a human to go do these things. And you can deploy this in many different areas. You can deploy it for what I talked about in terms of reporting to state and federal agencies, but you can deploy it in your revenue cycle, right? Why should a human being be entering remittance manually. I don't see any reason why. And so there are things like that we need to look at across the board to leverage technology and leverage automation tools to automate repetitive tasks.
So, when you're talking about automation, I'd like to take that one step further. You've talked about administrative tasks, filing reports. I know there's automation for AI helpers for people who call in. I mean, all those administrative tasks. But what about on the clinical side? Are there pieces that can be used to automate the clinical process too?
Yeah, I think that there are. And when we say automation in the clinical space, we need to be careful, because what we're not talking about is a bot writing clinical documentation for a clinic. Right? We don't want to do that. Right. We don't want to leverage ChatGPT or GPT-4 to go create progress notes. It's not HIPAA compliant. It's not best practice. But there are tools that can be used to make the documentation process a lot easier. And our organizations actually worked together to do a study. And I think part of that study was, or one of the results that we found was, the average clinician spends 40% of their time on documentation. And that's a huge number, right? It's 2 days out of every 5-day work week, but it doesn't really manifest that way. It manifests that way in nights and weekends, right? Where when a clinician should be having dinner with their family, they're catching up on progress notes, right? And when they should be, doing something different, they're catching up on documentation. And technology exists today to make that process easier, where it's not AI creating a note for a clinician, but it is leveraging things like natural language processing in order to create a recommendation engine and create shortcuts for clinicians so they can create true person-centered documentation, true individualized documentation a lot easier, because these tools can dig into all of the different data that exists on the individual that you're serving from their EHR. They can serve it up to you in a very usable way, and they can use it to make recommendations for how you write your documentation, and not only make it quicker, but make it a heck of a lot of a higher level of quality, so that back and forth time that all clinicians hate when their documentation gets rejected, we can just eliminate that entirely.
So it really is, as I'm thinking about your whole approach to how do you manage the bottom line, it really is how do you select the right technologies for your process and use them to eliminate or at least shorten the amount of non-productive time, either on the administrative side or the clinical side, so you essentially get more leverage out of your human capital. Is that a good summary?
I think it is a good summary, right? And I think those are areas of focus, right? We talked about, or the call to action for top line, it was go play some offense, right? And I think the call to action for bottom line is go find ways to automate, right? Automation is key. Automation is the future of technology in our space.
Well, that brings us to, that's a great pivot to a question I had that I wanted to use as a way to kind of wrap up our discussion today. And that is about, the future. And while I know you can't exactly predict the future, what I think our listeners would really like to know is, if you're an executive at a behavioral health provider organization, what are the 3 or 4 scientific developments or new technologies that you would recommend that they keep tabs on as part of their future strategy development?
You're right. We can't predict the future, but I think it's part of our job to try, right? And try and see around the corner a little bit and make recommendations for what the leaders of behavioral health organizations should be focused on. And I'll do my best to give you the 3. The first one is exactly what we were talking about, right? It is AI. AI is everywhere today. But there are different forms of AI, right? AI is a school of data science that really describes how you can leverage technology to perform a task that historically only a human could perform. And there are lots of different ways to do that. And we talked about those previously in terms of natural language processing to help with clinical documentation, robotic process automation to automate repetitive tasks. And I do think we as an organization need to figure out how the neural network type of AI, which is what GPT-4 is, how we leverage that in a really responsible way, right? So I think AI is number one. Number 2 is I believe that the way that we interface with technology is going to change dramatically over the next 5 years. And It's a little bit of a safe bet because it's already changed over the last 5 years, right? We went from primarily interfacing with technology via laptops and computers to mobile devices. And I think the same thing is going to happen in the future, where we look at spatial computing, where we look at potentially just wearables being used in a different way. And I think we need to pay attention to how we can leverage these technologies so that you kind of remove the barrier between the human and the technology, and you make it a lot easier to use. And then I think the final thing that we need to look at is how to responsibly leverage digital therapeutics in our space. And what I mean by digital therapeutics is the technology that you give directly to a consumer to help to deliver their care. And I don't think we'll ever be in a position where it replaces the human. That's not what I'm advocating for. But it can keep that individual more engaged in between sessions that they have with a clinician, and that can lead to better outcomes. And I think from our perspective, it is how can we leverage those in a way that's responsible, that drives better outcomes, and that's measurable for the impact that it has on the overall healthcare of the people that we're working with.
Well, I think you said one important piece there, regardless of what that new technology is that comes down the pipe. And that is, I really can't emphasize enough the importance for executive teams to have data about how things work. What are the effects on cost? What are the effects on the factors that are relevant to payers? And most importantly, what are the effects on consumer outcomes, consumer performance? There are so many new and emerging technologies, but I find very little organized effort to try to measure their effect. And don't you think that's going to be what differentiates the organizations that are successful and not successful with doing some of these new things?
I do. I absolutely do. And I can tell you some of the things that we're focused on, right? So we're focused on measuring, the impact that emerging technologies have on the users of that technology, right? So two main initiatives that we have is, number one, we want to reduce the amount of time that it takes for our users, clinicians, to complete key workflows by 30% over the next 4 years. It's an interesting place to be as a technologist because you're designing technology to make it used less, but it's absolutely something that we need to do. And then number two, we need that technology to be easier to learn, right? More intuitive. And over the same period of time, our goal is to reduce the amount of time it takes to educate, train, and ramp up a new user by 50%. And these are all things where we have monitoring deployed directly into our technology to measure how much time these things take, right? But that's the impact on the user, the either the clinician, the front desk worker, or the revenue cycle management professional. I think to your point, it's also incumbent on us to measure the impact that it has on the individuals that our clients are serving, and that goes directly to outcomes measures. And the other part of technology that we haven't really talked about is analytics, right? It's business intelligence tools. It's how you use data to learn more about the effectiveness of your organization from a business perspective, from a clinical perspective, really whatever you're looking for. And, you absolutely need to be able to measure those outcomes, and you need to overlay changes in treatment protocol, like the adoption of a digital therapeutic, so you can measure the impact it has on your population.
Well, I think that's, I think that three-part approach we've talked about how do you drive top line, how do you assure a bottom line, and then, how do you keep your eye on the future and be constantly innovating is really the formula that I hope more and more of our behavioral health provider organizations adopt as their strategic planning framework for the future. And I really look forward to future discussions and perhaps checking in a few months and seeing what are the new developments and how has this changed. So thank you, Dave. This has been a great discussion, and I look forward to the next one.
Thank you, Monica. I do too. It's always a pleasure talking to you, and I'm really looking forward to checking back in a few months.
At Netsmart, we understand the challenges facing provider organizations. Our team will help you navigate changing value-based care models with solutions and services that make person-centered care a reality. We'll equip you with technology and services that provide holistic, real-time views of care histories that inform better decision-making and better outcomes. Visit us today at ntst.com. Netsmart, serving you so you can serve others. Thanks for listening to the Netsmart Care Threads podcast. Through collaboration and conversation, we can work together to make healthcare more connected than ever before and better support the communities we serve. To ensure you never miss an episode, please subscribe to the show in your favorite podcast player. If you use Apple Podcasts, we'd love for you to give us a quick rating for the show. Just tap the number of stars that you think the podcast deserves. Until next time.